Hi everyone, it's Marvin here. Today we're going to talk about sickle cell anemia, and I think it's going to be a bit of revision from your biology A levels about hemoglobin, about structure and function of red blood cells, and we're going to take it a bit further. We're going to talk about what you'll see in the next slide. So beyond the kind of A level basics of red blood cells and hemoglobin, we'll also talk about sickle cell anemia, which is mentioned sort of in passing in a lot of A level syllabuses. But we're really going to talk about sort of what goes wrong, why it goes wrong, and then just illustrate it all with a clinical case study and briefly talk about some treatments. So our red blood cells, or erythrocytes, are these funny looking, almost donut-shaped cells. Their function is just to transport oxygen around the body. They're specialist cells, and what's quite special about them, besides this biconcave shape, is the fact they don't have any nuclei. They're enucleated cells, effectively. So that leaves more space for hemoglobin, which means more space for oxygen transport. And another feature of this shape, this sort of biconcave circular shape, is that they're quite soft and squidgy. So in smaller capillaries, in capillary beds like your lungs and other places where they're very small, these cells do really well. They kind of bend and squeeze and they get through the capillaries without any problems. And these cells normally live for about 120 days on average. So each red blood cell is completely stuffed full of hemoglobin. I think about 90–95% of the weight of a red blood cell is just hemoglobin. So 100, 200 million of these molecules are present in each red blood cell. And what hemoglobin does is that it allows oxygen, a huge amount of oxygen, to be transported. Because oxygen, like many gases, it is soluble in liquid. So we do have a small amount of oxygen that's just dissolved in our blood, in our serum, but it's really not enough. So this molecule allows us to transport oxygen from the lungs, where there's lots of oxygen, to the tissues, where there's much less oxygen and which needs the oxygen. And it does that because it's a globular protein, so it's not fibrous, it's not stringy, it's kind of like a blob, and it's tetrameric, so it's made out of 4 subunits, which come together to make this one hemoglobin protein. There's 2 kinds of subunits. So we have an alpha subunit and a beta subunit. And each subunit contains a heme group, which contains this ion. And it's the ion that allows oxygen to bind to the heme group and to be transported in the hemoglobin, in the red blood cells around the body. So what is sickle cell anemia? If we break down the term itself, sickle cell refers to the shape of the cells. So instead of this nice biconcave shape, which on a blood smear, if you take some red blood cells from someone's blood, you put them under a microscope and you have a look, what it should look like is almost like a bullseye target. So a circle on the outside and then a little dot on the inside, which you can see maybe in the background of this slide between the panels. But a sickle is an abnormal shape, and if you don't know, a sickle is like a farming implement. It's like a big long stick with a long curved blade on the end, and that's sometimes used to cut grass or wheat and things like that. And it's called sickle cell because these cells they can sometimes form an abnormal shape, this sickle shape, and that causes all sorts of problems. And the other part of the name is anemia. Anemia is a low amount of hemoglobin in the blood, and that's because those sickle cells that we talked about, they're not very robust. They're quite fragile. They can pop open. They don't last as long. And so generally, you're going to have a lower level of hemoglobin in the blood as all these cells are popping open. And a bit more about sickle cell. It's an inherited form of anemia, and it's due to a mutation in the hemoglobin gene. And that mutation is responsible for the sickling change. And as we mentioned, the sickling, it can cause these blood cells to become stuck because they're no longer soft and squidgy and malleable. But actually, these sickle cells are really they're quite fragile, but they're also quite brittle in a way that they can get stuck in small vessels, and that can cause death because of cells because there's not enough oxygen getting to tissues. And if we talk a bit about the exact mechanism, So that single change in the gene causes an amino acid to change. So healthy hemoglobin has a hydrophilic sixth amino acid in the chain. It's hydrophilic. It likes water. It likes to be associated with water. But in a sickle cell, that becomes a hydrophobic amino acid. It doesn't like water at all. And in low oxygen conditions, when there's low amounts of oxygen in the cellular environment, that amino acid essentially is exposed. It comes out because it changes shape, and all these hemoglobin molecules, they polymerize. They form these big long stacks on top of each other in an attempt to almost hide these hydrophobic amino acids. And as a result, we get these very long sort of rods, crystallized hemoglobin proteins, which change the shape of the cell. They cause the sickling. They make them fragile, inflexible, and it causes blockages of blood vessels. The other thing to know about sickle cell is I think it's a very horrible disease for a lot of people. And I'm not saying this as a kind of redeeming feature, but something to note is that if you look at the distribution of sickle cell globally, so in the bottom left, that's a schematic of the continent of Africa, and you can see where malaria on the right-hand side, that's where malaria is. On the left-hand side, that's where sickle cell is present. And essentially, having sickle cell is protective against malaria to some extent. And that can give one evolutionary explanation for why we have so much sickle cell in not only sub-Saharan Africa that you can see here, but also in parts of India, in the Middle East, and the Mediterranean, in sort of Greece, Cyprus, Turkey, these kinds of areas. Some more A-level revision for you. So the inheritance of sickle cell is autosomal recessive, and we get one allele from each parent for hemoglobin, for the beta subunit of hemoglobin, I should say. And as a result, we can have two disease possibilities. We can either have a single faulty gene, which is called sickle cell trait. We can call it HBS as well. It's a more mild form generally. And if you have two faulty genes, then you end up with sickle cell anemia, the full-blown sickle cell, which is generally quite severe, and this is quite a serious condition to have. On the right-hand side, you can see a Punnett square. So if we work through this, the big A is a healthy hemoglobin, so to speak, and the little a is going to be the sickle cell allele. So in this diagram, both parents are going to be carriers. So they each have one sickle cell gene. And if we go through all the possibilities, then we have a 1 in 4 chance of a healthy sickle-free child. We have a 2 in 4 or a 50% chance of having a carrier. And there's also a 1 in 4 chance of having sickle cell anemia. And this is really relevant in some parts of the world where there's a lot of sickle cell. So in certain parts of Nigeria, for example, where there's a lot of sickle cell going around, people will do genetic testing sometimes to find out if they're a carrier, and then they might not want to have children if they see another carrier. So that's actually a really important real life piece of information there. There's lots of different ways that sickle cell can be seen in hospital. This is one that I saw myself. Obviously, it's anonymized, but we have John. He's a 34-year-old man, and he comes to his local A&E for the 4th time this year, and he's wrapped up in about 4 woolen jumpers and sort of legging things. He greets the doctors by their first names. They seem to get on very well, and he looks in a lot of discomfort. The doctors talk to him. They find out he's got a 3-day history. He's got fever, cough, and really bad chest and hip pain, which hasn't been helped by anything he's taken at home. The first thing he asks for is some morphine to help with the pain. And I mention that because these patients often need really, really strong pain relief, really strong drugs to treat the pain because it's very, very, very painful. And unfortunately, for some people, some doctors, some healthcare people who are not so experienced with sickle cell, they can sometimes see this as drug-seeking behavior. They think, oh, they're asking for morphine, they're asking for these strong addictive drugs, and people feel uncomfortable. But actually, it's a very humane thing to give appropriate pain relief to someone who needs it. So what happens in this case is the doctors go and have a look in the patient's notes. They find his sickle cell care plan. And some hospitals in areas where there's a lot of sickle cell, they have actually an individual care plan for each patient. So there'll be a list of medications which work, pain meds which work, the doses, all of that stuff. And as soon as the patient rocks up to A&E, they get the plan and they get given the medication. And that's what happens here. So he's admitted to the ward, but before that, he's given some morphine, really strong painkiller, some antibiotics, and oxygen. And what's happened in this case is that John's having an acute chest syndrome. So if we look at that image, we can see all of these blood vessels in the lungs. There's a huge amount of blood vessels, very small blood vessels in the lungs. And if you imagine that one or two of them gets blocked and the tissue starts to die, gets a bit angry, there's inflammation going on, and that causes more sickling to happen because there's even less oxygen now because there's all this inflammation going on. So what can start off as a maybe potentially like a small flu could really develop into something very, very life-threatening, very, very dangerous. And this is one of the big things we worry about with sickle cell. So a bit about treatments. There are some medications which can reduce the amount of crises that you have, of sickle cell crises, like we saw with that acute chest syndrome where you have a blockage of blood vessels and it kind of snowballs into more blockages, more pain, more tissue death and that kind of thing. So there are some meds that help with that. And well, if you're someone with sickle cell and you have had a few crises, these people really know, they're experts on their conditions. They know about avoiding their triggers. And that can be something like avoiding the cold, avoiding exercising too hard, avoiding dehydration, being really careful when you have any kind of a flu. Blood transfusions are sometimes used because if the hemoglobin is too low, there's a problem with transporting enough oxygen. So we give these patients sometimes more blood, more hemoglobin. Then in terms of permanent treatments, bone marrow transplant is a possibility. That involves removing all of someone's bone marrow, which is the inside of the bone, which is where red blood cells are produced. You can remove that and then inject someone else's bone marrow tissue. So you end up with someone else's red blood cells, effectively. That sounds painful, and it is, and there's not a lot of bone marrow donors. And it's very expensive and difficult treatment in a lot of ways. What's very promising is gene therapies. This is a great candidate for gene therapies. It's a single genetic error, and recently the NHS approved a treatment for sickle cell. It's extremely expensive, over £1 million, but when you think about the amount of time and hospital admissions that you're saving, actually the money kind of adds up. And this treatment basically involves taking out someone's stem cells in their bone marrow. So taking out bone marrow, you genetically alter the bone marrow and then you put it back in. So you corrected the error, the genetic error, and now these people are producing normal hemoglobin and they won't be getting any sickling. So that's a really revolutionary treatment. Not yet widely available, but hopefully more and more people will have access to that. So we've talked a bit about sickle cell and hopefully a bit about the hemoglobin, red blood cells, what it looks like in sickle cell, and some treatments. I hope that was useful.